intelligence-based training program on handling and care of laboratory animals. Now, I would like to introduce our speaker. We are Rajan sir from National Institute of Immunity, New Delhi, as our first speaker of the day. Today, sir will enlighten us on the topic animal models to study diabetes, cardiovascular, and cancer research. Our next speaker of the day is Dr. Chandragora R. Patel sir from the Department of Pharmacology, DIPSRU, New Delhi. Today, sir will enlighten us on the topic, the beauty of behavioral tests. Now it's time to start today's session. Before starting this session, I would request to all the participants that if you have any question during the session, then you may raise your hands or you may also leave your answers in the chat box. Thank you so much. Now I would like to take permission from the head of the department, Dr. Nitin Sharma, sir, to proceed the program further. Sir, may I?
Go ahead, madam. Go ahead, please.
Okay, thank you so much, sir. On behalf of the Pharmaceutical Technology Department, MIET Meerut, I would like to welcome our first speaker of the day, Dr. P. Nagarajan, sir. Dr. P. Nagarajan is currently working as head scientist at Laboratory Animal Facility, National Institute of Immunology, New Delhi, India. Being a veterinarian, he has been working on the laboratory animals for more than 20 years. Sir has a vast knowledge and expertise in care, management, breeding, and medicine of laboratory animals, including genetically modified animals, immunodeficient animal models, humanized animal models, and non-human primates that are being used in the research. Before joining National Institute of Immunology, sir has worked at Central Drug Research Institute, CDRI, and National University of Singapore. He had undergone a diverse training in the laboratory animals, including imaging, modalities, and neurosurgery abroad. Model for various diseases and in particularly metabolic diseases. Sir has published more than 35 research articles in peer-reviewed international journals and authored book chapters. He is also serving as reviewer for various international journals, and sir is also a member of several national and international scientific societies related to laboratory animal sciences. With these words, I would respectfully call our first speaker, Dr. P. Nagarajan, sir, to share his knowledge among our participants. Over to you, sir.
Thank you, Preeti. And thank you, Dr. Nitin, for providing me an opportunity to deliver this lecture. And I'm very much thankful that I could share some knowledge on something about the animal models for diabetes, cardiovascular, and cancer research. To go ahead, first of all, we need to understand what is the basic physiological criteria, and reproductive behavior of a laboratory mouse, actually. Without that, there is no point of thinking about anything related to the animal models. You know, the mice they are using. First of all, we want to say about, I'm more concentrated, and my topic will be more on this mouse model, because why I'm taking this mouse model is, you know, the mouse model is mostly used for all types of research, including what I'm going to deliver in this topic. And to know about the mouse models, and you need to exactly know about what is the, you know, the breeding season and gestation period and litter size and the birth weight and the weaning age and weaning weight and the return to estrus. This means what I want to say is this mouse is spontaneously ovulated, and you can breed the mouse all over the year, and the number of pups you can get is more actually. So you can design your experiment and you can perform the experiment based on because of this type of physiological parameters. And to come to the mouse, you know, usually the sexual maturity is usually occurred at, you know, 5 to 8 weeks, and it becomes estrus. This is the cycle of a mouse actually, and it becomes estrus, and after that there will be a mating or conception. Within 20 days, it will be the pregnancy period, and the birth will be after that 21. You know, just after that. Then within 3 weeks, we can wean the mice. Wean the mice means separate the mice from the pups from the mother, And again, you can use for the research. This is a cycle of a mouse. Continuously in a year, you can continuously breed and you can use the pups for various research. So that is the model organism. It is a good model organism to get enough pups, and you can manipulate the animals, and you can perform all types of experiment. Coming to the mouse, the mouse is not simply, if you breed one male and one female, it is whatever pups which you are getting, we can't use directly for research. There are many strains of mouse actually, like inbred strains and F1 hybrid and co-isogenic inbred strains, congenic inbred strains, and recombinant inbred strains and genetically modified strains. These are the many mouse strains available. One is the breeding of mouse will be either by inbreeding or outbreeding. Usually inbreeding is used for most of this, what I mean to say is this for diabetic research, cardiovascular research, and cancer research. Most of the mouse strains which we are getting is all of inbred strains. And the outbred stock is mostly used for toxicological research actually, because it is the genes are heterozygous, and it can be used mostly for toxicology research. These inbred strains are mostly used for immunological, genetic, or anything related to that. And there are some strains behind that. There are F1 hybrids, co-isogenic, and congenic, and recombinant, and genetically modified animals. This genetically modified is something we are changing the genome of the mouse, either by inserting, or you can remove the gene, or by insertion of the gene is called transgenic. Inserting the new gene into the genome of the mouse is called transgenic, and removing a gene from a mouse of interest is called as knockout. These are some of the things. It is a big topic actually. Mouse genetic is a big topic that I don't want to be more on that, so it will be more timing. So just it's a basic thing. What are the mouse strains which we are used for research? These are some of the mouse actually. See, commonly used mouse strains which are commonly used for research. What you call as BOBC, C57 black seeds. This is C3H mouse. And there are more than 1,000 strains of mouse. Why I'm just selecting these mouse strains is these strains are mostly used for research. This is BOBC. You can see most of the institute use this BOBC, and black seeds, C57 black seeds. This is another inbred strains. Whatever strains which I'm mentioning here are all inbred strains. And this is OB mouse. OB mouse is something like obese mouse, which I will talk in the topic on the diabetic. And this mouse is also, we call it as OB. There is a mouse called nude mouse. Nude mouse, something, it is also, which I will talk it on the cancer studies. And there is a mouse called skin mouse. These are some of the important mouse strains, in particular inbred strains, which are very commonly used for biomedical research, in particular to this diabetic, cardiovascular, and cancer research. To come to know, whatever we can talk about the all strains of mouse or anything, but the basic thing we should not forget actually the anatomy of the mouse or anything. First of all, to identify a mouse, whether it is a male or female, the distance we are considering, the anogenital distance, where you can see the mark, yellow mark here. This is the anogenital distance. It is the anogenital distance is smaller in case of female and it is larger in case of male. This is the important criteria which we should understand before performing any experiment, that whether we have to select a particular gender of the mouse before doing any research. And this is something interesting feature which everyone should know actually. Some the mouse are very nocturnal and they make very active at the night and delight in nest making. What I'm saying is this mouse are nocturnal animals. For diabetic research, it plays an important role. And during diabetic research, we need to fast the animals for 12 hours or that time. And if you are fasting in the daytime, the calorie intake and everything will get changed. So it is always better to fast the mice in the night because the activity of the mouse is more in the night time, and that helps in the evaluating the correct glucose level. And the mouse, it doesn't have it has poor vision. It doesn't have any good eye. It can't see properly, but its smell is very, very better actually. And you can even sense of smell is very, very good, and it helps to communicate very better. The pheromones, and because of the pheromones, it is the mice also produce some pheromones. Pheromone means some secretion which helps to identify the male partner, or it is used mostly for reproductive biology. And another thing is the mouse doesn't have sweat glands. It can't pant, and its inability to salivate is limited. That like humans or dogs or large animals, when there is any more temperature or humidity, anything, the body tends to control the temperature, and either by salivation or vomiting and by sweating. But mouse, it is unable to sweat because they don't have sweat glands. It cannot pant, and salivation is limited. So that's the reason we keep the mouse in a proper environmental housing temperature. That means this temperature and this humidity, people used to say it like that. This is the reason we need to keep the mouse in a proper environmental conditions. This is the model of the animal house actually, and this is the mouse where the mouse are kept in what we call it as individual ventilated caging system, and this is the cages actually where the mouse are kept, and the mouse inside the cage will be he'll be like this actually. You can see the cages how it is, and the mouse will be housed in like this. These are the feed, and this is there will be a water bottle here, and the mouse will be happily thing. Where this in the individual ventilated caging system, the temperature, humidity, everything will be monitored properly. And something like that, before going for any thing, you need to performing any research or doing any research, we need to that is properly handle the mice. This is the one of the way of handling the mouse, and if you are handling too tight, it will die. So proper training in handling the mouse is more important before doing any research. And these are some of the common drug of administration in mouse, either by subcutaneous, intraperitoneal, intravenous, and oral gouging. Oral gouging is nothing but giving drugs in the orally. This is drugs during tail, that is intravenous. This is, we can give the mouse by intraperitoneal, and subcutaneous is below the skin. This is the subcutaneous mode of injection where we give the mouse. This is another subcutaneous in case of nude mouse, where I will discuss later, to inject some cancer cells to develop a model of cancer. And this is, the procedure to inject intradermally. This is for raising some antibody. This is the procedure where we give in oral gouging. That means giving drugs, any drugs at orally. And coming to the thing, and now I have shown you some of the procedures. This is what I want to show is just everyone should understand the basic procedures and what are the things, physiology of the mouse before doing any type of experiment. Without knowing the basic physiology or basic anything, it is unfair, and it is not advisable to do any research in the mouse model. And this is the mouse, and the mouse is something you can't you can't collect. For every research you need to collect some blood, and you should consider and carefully do collect the proper blood. Actually, in a mouse there are about 2 ml of the blood, that is 1.8 to 2 ml of the blood available. And total blood volume in a mouse actually is 2 ml. And see that, and you have to collect only 200 microliter of blood. That is, you have to collect only 200 microliter of blood, and that too at an interval of 14 days. That is, you can't collect blood every day or every week. This is more important. So these are the many physiological parameters which we consider and before doing any types of research. This is something like identification of the rodents. How we have to, because there is a numbering pattern, and these are the numbering pattern which we identify each mouse. What is the number of each mouse, and what drug you are given to each mouse. Okay, these are the previous slide which I had just mentioned about something very, very little about the basic physiology and something which is very important to carry out any types of research in an animal model. Now we come to the exact topic which of interest, and animal models. For an animal model, it may be either spontaneous or induced. Spontaneous means it is spontaneously occurring any diseases. For any mouse strain which occurs spontaneously any type of disease, we call it as spontaneously animal model. This is one type of mouse strain called as AJ. AJ is one strain like Bobsey or black seeds. These mice after some years will have spontaneously adenoma, lung adenoma, and this mouse strain will have that means hearing loss, and it is diabetes and obesity, whenever it is resistant to diabetes and obesity, this is the mouse strain which is spontaneously occurring this type of disease. And another one strain is called an NSO, and this is causes severe obesity and impaired glucose tolerance, and it is type 2 diabetes. It can be developed. This is some of the two mouse strains. There are many hundreds of mouse strains which has specifically developed specifically some certain type of disease, and we can immediately use for research. And we can't use all, which can be, there are many strains be used for disease. And there is another, there is a below is the called as the induced model. Induced model is something which you are giving some drugs or anything and induce the animal to certain disease. One is spontaneous, means which is spontaneously occurring certain type of disease. The mouse system will spontaneously develop some type of disease. The other is called as induced system, where you can see this is a mouse. This is CFA, the type 2 collagen or CFA is injected into the mouse. And after some days, 4 to 10 days, this mouse will develop arthritis. And this arthritis mouse model can be used for arthritis. This is example of showing what is spontaneous and induced. See, spontaneous mutation is something in a normal phenotypic and pathogenic. For example, when a mouse colony is bred for many inbred generation, they are breeding with inbred for many generations. Say, for example, 20 or more generation, what we call as inbred mouse. And at one particular point, there will be a gene will get spontaneously mutated. And during the mutation of a particular gene, the mouse will form a certain type of diseases. This happened in many cases of mouse strains. For example, skid mouse actually. And the skid mouse is something which we used for cancer research. What it happened is it is nothing but a Bobsy mice. After many generations, there was a gene called PRKTC gene. And what happened is this PRKTC gene got mutated. And due to the lack of mutation, this mouse doesn't produce T and B cells. And in fact, it became immunodeficient. This is something like spontaneously mutated. And is chemically, that means the genes are mutated or changed by either by induced, it can be by radiation or by chemical, so that the gene will be completely changed or mutated. And after mutation of a particular gene, and this can be used for research. The other third thing is this retroviral infection. This is how some of the mouse strains are developed by this is used for some transgenic or knockout protection. And the retrovirus with the transgene is incorporated into the embryo and it is implanted into the female. And after retroviral propagation, this offspring will have the transgene of interest, because the transgene means the gene of which we want to study, and they are introduced into the mouse embryo. So, for example, if you want to see some of the gene, what is going to happen if you insert a particular gene of interest, say for example, if you want to that hemoglobin gene, human hemoglobin, because mouse hemoglobin gene is different from the human hemoglobin gene. And the human beta hemoglobin gene from the human is inserted using the retrovirus and it is implanted in the female. And what is happening, the gene will be incorporated in the mouse genome, and the offspring will be having the gene of interest of human beta globin gene. So we can study what will be happening with the hemoglobin in this mouse strain. This is called as retrovirals. The same thing is like transgenesis, where a particular gene of interest is inserted in the embryo and it is implanted, and the offspring will be having the gene of interest, and it can be studied for a particular studies for any type of study. This is something like spontaneous or induced mutation to create a animal model. Now coming to the diabetes, which we are going to talk about, and these are the diabetes, the type 1 diabetes and type 2 diabetes. The type 2 diabetes, there will be no insulin, and in type 2 diabetes, it is insulin resistance. There no insulin it's mostly occurs in the type 1 diabetes is mostly occurs for the younger age actually, and due to it is we call it as autoimmune type of disease. And type 2 is like it occurs, it is due to the changes in the food habit or changes into the something like that. and where the insulin is resistant. And here the insulin is not produced actually because of these are the difference between the type 1, type 2. Type 1 is like autoimmune type, and type 2 is like due to the change in the dietary modification or due to change in the food habits. There are, coming to the animal models for diabetes, there are already I told there is spontaneous and induced, and there is transgenic. See, type 1 in animal model of diabetes, there is type 1 diabetes. What it happens is immune depletion of beta cells. That is, beta cells is mainly important to produce insulin. In type 1 diabetes, what is happening is the beta cells are completely destroyed, or it is not produced in type 1 diabetes. So when the beta cells are not there, or it is not able to produce, obviously it will causes insulin will not be produced, and it causes type 1 diabetes. The other way of inducing diabetes, type 1 diabetes, is injection of SDS, streptozotocin or alloxan induced diabetes, where this alloxan and SDS, it is both are chemical. What will happen is when you inject to the animal, the beta cells are completely destroyed. When beta cells are completely destroyed, and it cannot produce insulin. So this is a model for, these are the mouse model, NOD mouse and BB rat, where during, we are not going to destroy anything by chemical, but automatically by spontaneously this NOD mice and BB rat have beta cell destruction. So it causes type 1 diabetes. And type 2 diabetes is something like that. It can be like spontaneous. Spontaneous is leper, what we call as DBDB mice, OB mice, and sugar fat diabetic rat. These are the genetically, spontaneously mutated mouse, actually. Leper, the DBDB mice, leper mice, and fatty liver disease mice. Or other way is by giving high fat, by feeding, this type 2 diabetes is developed. These are the two methods where two types of diabetes, type 1 diabetes and type 2 diabetes, where type 1 diabetes, I already told, beta cells are destroyed, and type 2 diabetes is using high fat or mutated. This is in type 1 diabetes. Already I told that the immune cells destroys beta cells in the pancreas. This is what we call it as that autoimmune type of disease, where the beta cells are completely destroyed and pancreas cannot produce insulin. And this is what we call it as type 1 diabetes. The pancreas is the main source of producing insulin. And inside the pancreas, there are beta cells. When the beta cells are destroyed, the insulin will not be produced, and obviously type 1 diabetes is occurred. This is one of the mouse, what we call as NOD mouse, non-obese diabetic mouse. This is a good model for type 1 diabetes, where it develops autoimmune diabetes at the 5 weeks of age. What is going to happen is the complete insulin, beta cells is completely destroyed, and due to the destroy of the beta cells, the insulin cannot be produced. And this is a model for diabetes type 1 particularly, because this NOD mouse, if you see, it doesn't have, it has B lymphocyte, T lymphocyte antibodies, but it is lacking in dendritic cells. And here it lacks complement system, macrophages, and natural killer cells. This natural killer cells is also absent, and and dendritic cells. What are the natural cells are absent? Dendritic cells are absent. Complement system is absent. Macrophages is absent due to the autoimmune. This is spontaneously occurred mouse, where this type of cells are absent, and due to the absence of this type of dendritic cells or NK cells, they develop spontaneously autoimmune diabetic, and what we call it as type 1 diabetes. This is a second mouse called as Akita mouse. It is also, developed spontaneously at the early stage. That is, it is also developed spontaneous diabetes at the early stage. And due to the INS2 gene mutation, there was a mutation in the INS2 gene, and it causes the insulitis, which I mean to say is the beta cells of the pancreas is completely destroyed. And so it produces hyperglycemia and hypoinsulinemia, and at the age of 3 to 4 weeks of age. This is another mouse model. The one mouse model of type 1 is Akita, and the other one is NOD mouse. The other, coming to the rat, these are the another rat model which developed what we call as BB rat and SFR super rats. These are the rat model. The same thing happens here, where the complete destroy of the pancreatic beta cells, And diabetes, it occurs within 6 to 7 weeks. The animals will develop type 1 diabetes. And second things, already what I before told, like NOD mice and Akita mice and BB rat, all are spontaneously, which means automatically due to the mutation of certain gene or anything, the spontaneously diabetes occurred. This is something which is caused by chemically induced. This is called as, already I told us ST, streptozotocin. This is a chemical where when we give this chemical into the mouse, it causes beta cells reduction. And it causes complete damage of the beta cells. This chemical induced destruction of the beta cells is another method to create type 1 diabetes. These are the doses which we give for streptozotocin, and for any mouse strain, irrespective of NOD or anything, any mouse strain, even black sits or BOB-C or anything. If you want to develop, if some institute doesn't have the this spontaneously mutated model, we can induce type 1 diabetes by using the chemicals such as, this bulbs, like using streptozotocin or alloxan. This is the dose which we give for the mouse. And after a few days, after 4 to 5 days, automatically the beta cells get destroyed and it causes diabetes, type 1 diabetes. Now we'll come to the type 2 diabetes. These are the animal models, good animal model where we can develop diet induced by giving high diet will create type 2 diabetes. These are the C57BL6J, AKR, DBA2J, Vista rats, ST rats. And these are the diet-induced models, spontaneously muted. That is spontaneously muted model, I already told is DBDB mice, OB mice, and SH rats. These are spontaneously occur diabetes model. These are chemically induced diabetic model. There are some other transgenic and animal model to overexpress the particular type of gene of interest or remove the gene of interest, so that the animal will have the type 2 diabetes. This is the type 2 diabetes, how we are going to develop using the high-fat diet, high-fat, high-fructose diet, and methionine choline-resistant diet. And even for a normal mouse, we give some, the percentage of fat will be 4% to 5%. And in case of high-fat diet, we give 45 to 60% of fat, 60% of fat, kilocalories, we get it from the fat. So high fat, the more amount of fat it is taking, the excess of fat will try to develop diabetes actually. This is a mouse which like BOB-C or black seeds. After eating this high fat diet, you can see the obese structure, and obviously it will develop type 2 diabetes. This is the other way of inducing type 2 diabetes using chemically, not chemically diet induced. This is what is happening is when you give a high fat diet, the visceral obesity, you can see the animal is so big, and when there is obesity, there will be inflammation, and then when there is inflammation, there is a lipotoxicity, there will be a metabolic dysfunction, and automatically it gets hyperglycemia. Hyperglycemia, what is meant by high glucose and insulin resistant. That means insulin is not able to, the glucose uptake is not proper, and decrease autophagy. And hyperinsulinemia happen to the animal when we have high fat diet actually. This is the second method of creating type 2 diabetes in using high fat diet. This is from the birth at the 6th week of age. Already I told you the most we use for research is from 6 to 8 weeks, and 6 weeks of age we give high fat diet, and within 18 weeks, that in 12 weeks, 12 to 13 weeks, we'll give the we'll check the glucose tolerance and insulin tolerance also, and see whether the animal has developed glucose that will have diabetes or not. And which animal after 18 weeks which has developed diabetes will be used for type 2 diabetic animal model. See, this is the intravenous glucose tolerance test for a normal person. After giving, this is something like we are giving the glucose and see how the glucose is coming down. For a normal person, when we are giving a glucose, and you can see it is coming to the normal level. But when we are giving to the diabetic person, it goes on and it will not come to the normal level. The same in case of insulin also. But you can see the peak period, the time taking to come to the normal level is a little bit higher compared to the normal level, normal mouse. This is some of the important tests like glucose tolerance test or insulin tolerance test, and measure the glucose level to check the whether this animal is having diabetes after giving high fat diet or not. This is a mouse. Actually, see, you can see the obesity, that is the fat get deposited and how it looks like, the fat is like the abdominal adipose tissue fat. And when there is more amount of adipose tissue fat, it causes inflammation and obviously inflammatory reaction, and obviously it will cause type 2 diabetes. The second thing which we are going to see is that is spontaneously mutated mouse model. This is one of the main spontaneously mutated model is called as DBTB mice or OBB mice, where the leopard gene, that is one of the mutation. Actually, leopard gene is one of the important thing which control the the food control the excessive hunger, weight gain, and other disorders. This leptin is important hormone. In this OBB and DBTB mice, this leptin receptor gene or leopard gene has some mutation, and when there is a mutation in the leopard gene, the animal will be unable to control the food intake, and the food which it has been taken is not metabolized properly. So this is due to the leopard gene mutation. Then what is happening is this DBTB mice, what it happens is the animal will take food, and all the food will not be clearly utilized. And there is no possibility to control the hunger. And the animal usually eat a lot. And when it takes eat a lot, and the obesity starts, and it becomes polydyskic, polyuric, and it causes, in addition to the diabetes, and it causes other types of myocardial disease and death within 10 months of age. This is something which is called a spontaneously mutated mouse for type 2 diabetes. This is another mouse which is called KK mouse. This is also same thing like that, where there was some mutation and it causes type 2 diabetes. This is a sukkar rat. This is another rat model where it is a good model for type 2 diabetes. And what is happening is, at the age of 6 to 7 weeks of age, the blood glucose will reach about 500 milligram per milligram per deciliter, and it will be a good model for type 2 diabetes. And this is some of the ingredients which we use for giving high fat diet to produce type 2 diabetes. And this is the body weight developed after giving high fat diet. See, this is a normal, this is a control, this is a controlled diet, high fat diet. This is controlled diet, how the body weight is, controlled diet, body weight is there. This is high fat diet, how the body weight growth is there. Now, coming to the next topic, I think we have talked about something about diabetic model, about the type 1 diabetic, type 2 diabetic, and the animal models used for, that is in particular mouse model used for type 1 diabetic and type 2 diabetic. Now we'll go for, that is cardiovascular disease model. That is 3 type of mouse actually. One is SHR, spontaneous hypertensive rat. What I already told is it occurs spontaneous hypertension. The second is Dahal salt sensitive. This is another type of mouse where using high salt, they are trying to develop hypertension model. And other is transgenic mouse model. This is where the REN2 gene is something mutated. Where they express overexpress this REN2 gene. And due to the overexpression of the REN2 gene, this mouse will have hypertension, and it causes hypertrophy, and most of the cardiac pathological changes will be noted in this type of mouse model. Now come to the SH rat. SHR, a spontaneous hypertensive rat, what we call as a spontaneous hypertensive rat, where the blood pressure usually, it goes to 200, the systolic. And it is also a good model for at the age of 7 to 8 weeks, it develops spontaneous hypertension. The second is DHL salt sensitive hypertensive rat. It is also a good animal model to develop hypertension, where they give some high salt and using another chemical, so that using 2 chemical and salt, this mouse model will develop hypertension at a particular age. Actually, usually at the age of 9 to 10 weeks, it develops hypertension. This is using salt and a chemical. The third is transgenic model, which I told is the REN2 gene is mutated. These are three mouse strains. This rat and mouse are mostly used for hypertension model. This is DOCA salt hypertensive rat model. What they do is actually they get nephrotomy. Nephrotomy means removing one kidney, and they inject DOCA. And this is dimethylformate, what we call as, and in addition they added NaCl. This is what they do is actually they remove one kidney, and what they inject is they give another chemical called DOCA, which is put it in pellet implantation. It is like device which will slowly release into the animal. And after, in addition, they give 0.1% of sodium chloride and 0.9% of sodium chloride. That means normal salt in drinking water. After a few days, this mouse will develop, hypertension. Very good model for hypertension by unilateral nephrotomy. That is, one kidney is removed and salt water is given, and there is a drug called DOCA. This is a good model for hypertension. And there is another way to develop hypertension. This is using flashing light, loud noise, resistant air cage, and cold or hot stimuli. This is normally happening to every person. When you have flashing light, loud noise, resistant, even a mouse will develop hypertension to this type of stress induced actually. And pharmacological hypertension is another way. If we are just inhibitor, NOS inhibitors, we are just injecting into the mouse. And what happens is when there is inhibition of NOS, nitrous oxide production, there will be a pharmacologically hypertension. This is another way how to create pharmacologic hypertension. The third way is renal hypertension, by going to create renal hypertension. And now comes the second model, where we call it as atherosclerosis. Atherosclerosis is something, another model. First we talked about the hypertension. Now we are going to see about the atherosclerosis. This is a normal. This is plague. The cholesterol streaks get deposited into the artery or the blood vessels of the heart supplying. So what is happening is, this is another, so it will, the blood flow to the blood vessels get interrupted. So what is happening is it causes atherosclerosis. One of the good model is this ApoE knockout. ApoE is something, ApoE lipoprotein. It is something lipoprotein. What it prevents is, when we have any high cholesterol or anything, this ApoE completely removes the cholesterol streaks. The apolipoprotein prevents the cholesterol formation, and it prevents the streaks, that is cholesterol streaks into the blood vessels. When the ApoE is knocked out, means the ApoE gene is removed from the gene of the mouse model. So there is no possibility to control the cholesterol streaks deposition in the blood vessels or artery. So this mouse model is a good ApoE knockout. This mouse model is a good model for inducing atherosclerosis. See, this is the mouse model. This ApoE mouse. When you are seeing, you can see the blood flag. You can see the cholesterol streaks, and you can see the cholesterol streaks, and you can see the cholesterol streaks. The cholesterol streaks get deposited into the heart coronary artery and other blood aorta. See blood, for example, aorta. And because of the lack of ApoE protein, so this, when there is blockage of this aorta or blood supply to the heart, obviously they will have so much of problem in the heart. And this is a ApoE mouse model, which is used for studying the atherosclerosis model. And this is how the the imaging, how it looks it. Mouse with low fat diet, how it looks it. When you use the high fat diet, it goes how it goes. It is something like comparing with the low. This is comparing with the low fat diet and high fat diet. How even it aggressively affect the streaks actually. And this is a aorta to show the cholesterol streaks. And this is another example to show you the another method to develop to atherosclerosis. There is a circumference artery occlusion. That is a occlusion. That means the artery is completely occluded with cholesterol streaks. You can see this is the normal, and see this is a problem, it is like this. And this is the thing where we get completely occluded. The cholesterol sticks get completely occluded. Now comes the cancer model. I think we have studied about the diabetic, something about the cardiovascular. Now comes to the cancer model. There are types of cancer model is, there is syngenic mouse model, chemotaxic IAGen mouse model, where we use the chemical to introduce, and third is genetically engineered mouse model, and fourth is human cell line or human cancer cells are transferred into the animal model, and it is developed and it develops cancer. See, for what is called as syngenic. Syngenic means if a mouse strain, for example, black seeds mouse or bulb seed, and the same tumor cells are implanted into the same mouse strain. For example, black seeds tumor cells are implanted into the black seeds mouse. That is called syngenic. Tumor from the mouse strain of the same strain is injected into the another strain. This can be done by subcutaneous or by orthotopic. Actually, subcutaneous or orthotopic. In subcutaneous, what happened is they go for usually they go for immunodeficient mouse. And where the orthotopic means something where we are injecting the cancer cells into the organ of interest. For example, if you want to create a lung cancer, or the cancer cells are injected into the lung, or if you want to go for a liver cancer, the cancer cells are injected into the liver. And this is something called as orthotopic. The fourth one is genetically engineered mouse model, where a gene is mutated so that it will develop the tumor of interest. Say, for example, for TRP53 is a gene which controls P53 is main planet, which prevents the tumor formation. And when the tumor TRP53 gene is knocked out or it is removed, the tumor progression will be developed and tumorigenesis will be developing. This is where genetically engineered mouse model, where we can knock out or introduce some gene of interest so that it will develop tumor. See, some of the mouse strains which are mostly used for, what you call it as tumor is called as nude mouse and skin mouse, non-skin mouse, interleukin 2 or gum mouse, rag1 mouse, non-skin mouse. And why this strain, this nude mouse? I'll come to the nude mouse. The nude mouse, this is a good model for cancer, and why it is used for research? Because if you say T cells is important to reject anything, and when the animal is lacking T cells, so whatever the cells we injecting, this animal will accept. So for an immune system to rejection, we need T cells, B cells, and NK cells. This is the immune cells, important immune cells. This nude mouse doesn't have this T cells. How this nude mouse was developed is, again, it's a story. There was a FOX1 gene mutation. This FOX1 gene, when there is a mutation, it doesn't produce T cell. And obviously the hair growth is arrested. So this mouse become hairless, and it is unable to produce any T cells. So this mouse model is used as whenever we inject any cells from any human or anything, it tries to accept it because there is no T cells to reject the tumor. And this is one of the good mouse model to study any cancer studies. Because already I told that this nude mice is FOX1 gene mutation, and it doesn't have T cells. In T cells, we have CD4 and CD8, and partial defect in B cells. When the CD4, CD8 are partial defect in the B cells are there will be, the animal is unable to reject anything, any cells. Even for infection, it is unable to fight against the infection. So this mouse model is used for cancer research. Now comes the second mouse, what we call as SCID mouse, severe compromised immunodeficient mouse. This is little bit higher version of the nude mouse. What is called as, in nude mouse, you can see only T cell is deficient. But in case of SCID mouse, both T and B cells are deficient, because in the immune system, there are three types of cells like T cells, B cells, and NK cells. So in SCID mouse, there is lacking T and B cells and little bit of NK cell depleted. Depleted means that is lesser. So you can see, but it is hairy. The one disadvantage is the nude mouse, it doesn't have hair, but this not SCID mouse, it is hairy. And the tumor, whatever tumor, if you want to develop, you can just cancer cells if you want to inject and see. And to study, this mouse will be used. This is the tumorigenicity of the nude mouse. This is called T and B cell deficient mouse. What I already told is skid mouse, ragone mouse, and skid mouse. In skid mouse, why is happening is there is a mutation. Already I told there is a mutation in PRKTC gene. This PRKTC gene is what is happening is it helps in the arrangement of VDG segments. When there is proper arrangement of VDG segments only, T cells and B cells will develop. When there is no VDG gene rearrangement is there, the T and B cells cannot be developed or produced. So this plays an important role of this PRKTC gene mutation plays an important role in the production of T and B cells. When there is a mutation in PRKTC gene, this mice doesn't produce T and B cells, so it can accept any cancer cells from any origin. Now, little bit higher version of the not skid, PRKTC skid is called as NSG mouse. This is what you call it as, it doesn't have any systems like B or T or NK cells or chemokines or cytokines. When there is nothing is there in the system, it is like, completely immunodeficient mouse model. So this mouse can be used for any humanization. Say how it is, since mouse can be, for example, you can take the human and the cancer is there. If the human is having a cancer patient and the tumor is taken, and what they are taken is they are inject the tumor is just transplanted into this NSG mouse, and if the tumor will be growing, and we can study whether which chemo targeted drugs can be helpful to cure this type of tumor. The other is some genetically modified mouse. What I already told, it is the gene is something modified, and what is the particular problem is that we can't implant the tumor cells of the human origin. We can study into the mouse because the other genes will be like mouse origin, and it has complete immune cells like T cells, B cells, and everything is there. So it is very difficult to use the human origin cancer cells using this transgenic, genetically modified animals. Now, third thing is very, very interesting. We call it as humanized mouse model. Humanized mouse model is something we are creating mouse as a human, where we inject the human CD34 cells is called as hematopoietic stem cells, and we inject into the NSG mouse. NSG mouse was what I already told is it doesn't contain any immune cells, and when you are injecting CD34 cells, this mouse will engraft the human cells population. And we can use this. These are the places where we can inject. You can inject into the kidney capsule, spleen, or tail vein. And this mouse can be used for many cancer studies. This is the cancer patient tumor, and it is resected. And what is we are injecting, and the tumor is grown. And after that, it is resected again. And then we can expand the mouse with various tumor cells. This is the primary tumor, and this is the secondary tumor. Again, we will inject to the many mouse to develop the tumor. This is how it happens. It's a for a patient derived, you are taking the tumor from the patient and injecting into the mouse, and the mouse will develop the tumor, and we will try to evaluate the drug actually, whether this drug cures this tumor or not. And when this works good, and it can be translated into the human. This is how the mouse model is really helpful to find the the cancer vaccine, cytokine therapy, combinational therapy, therapeutic agents, and immunotherapy. Without this mouse model, really very difficult for us to see the any cancer therapy or cancer drug therapy cannot be done in humans. And so this mouse model, irrespective of cancer, irrespective of diabetes, irrespective of the cardiovascular disease, everything, this mouse model plays an important role. I think everyone has understood something about some few models. It's a very big topic, but in a short time, I feel that I could able to give some points regarding to the animal models of this diabetic, cardiovascular, and what we call as cancer research. And thank you very much. And I ask if anyone wants any questions, can you please let me know?
Thank you so much, sir, for very well explanation about the diabetes, cardiovascular, and cancer related screening model. Sir, there is a question from Dr. Vandana Thakur, ma'am. Animal models for rheumatic arthritis are causing inflammation and pain in animals. So, is it valid to administer analgesics to relieve them from pain? Does it affect the result of test drug?
Yeah, exactly. Actually, see, for example, there are two types of mouse model. You call as DBA1, DBA2. DBA2 mouse model, and it is a spontaneously arthritis model. And in such type of mouse model, no need to give the painkiller. But in case of like collagen-induced arthritis or anything, sometimes it when you give this, there will be a pain. There will be a pain will be there. That is during the IAC protocol. Anything, if you are just mentioning this will interfere your research or anything, then we can just any scientific community will accept this, and it should not be for a longer period. And the pain should not be for a longer period, and it should be when we find more pain and distress, if animal is unable to eat or anything, it is better to euthanize. It's a for shorter period, it's okay, but it's not go for a longer time to assess the effect of any drug or anything.
Sir, there is another question from Dr. Manoj Kumar, sir. What is the difference between Swiss albino and Balbsi mouse?
Swiss albino is an outbred mouse actually, and Balbsi is an inbred mouse. Swiss albino, CD1, all are outbred mouse. Actually, it is a random mating. And Balbsi mice is an inbred mouse where we maintain the inbreeding, and all the genes from the pups are the complete, the pups will be homozygous of a particular allele of interest. And if you do the, it is what you call as homozygous and heterozygous actually. It's outbred and inbred, that's it.
Okay, is there any question from the participant side? Okay, thank you so much, sir, for sharing your knowledge and findings with us today. We are very fortunate to have you with us today, and thank you very much for such an in-depth and detailed information about the animal models to study diabetes, cardiovascular, and cancer research. Thank you very much, sir.
Okay, thank you.
Our second speaker, Dr. Chandragora R. Patil, sir, has already joined us, and I feel highly honored to welcome and introduce our next speaker of the day. Dr. Chandragora R. Patil, sir, is currently working as professor at Department of Pharmacology, DIPSRU, New Delhi. Before joining DIPSRU, he worked at SVPN's College of Pharmacy, Melgaon, and KLES College of Pharmacy, Belgaum, Karnataka, as a lecturer. Sir has also worked at R.C. Patel Institute of Pharmaceutical Education and Research as professor. Dr. Chandragora R. Patil is also the recipient of various professional recognition awards and certificates. Sir got fellowship for his PG course based on GATE exam with 96th percentile by MHRD, Government of India, from July 1996 to June 1998. Sir has also got Best Poster Presentation Award in the 7th World Congress on Alternatives to Animal Use in Life Sciences by Rome, Italy in 2009. Sir is also the recipient of Young Scientist Award by 6th World Congress on Alternatives to Animal Use in Life Sciences, Tokyo, Japan in the year 2007. Sir also got the Young Scientist Award by CCRH Ayush New Delhi in 2017. Sir is also the holder of Innovator Teacher Award by MHRD, Government of India, New Delhi in 2018. Sir has published various research articles in peer-reviewed international journals, and the citation of his publication is around 1382. He is the author of 2 books. One is online software entitled Xcology Pro, published with Elsewhere publication in the year 2011. And another one is a software CD entitled Xcology, published by Nirali Prakashan in 2005. Sir is the awardee of one patent, and he has also applied 3 patents to Indian Patent Office. Sir has guided around 55 postgraduated students and 5 PhD students. Now, I would respectfully invite our next speaker, Dr. Chandragowda R. Patil, sir, for his words of wisdom. Sir, please enlighten our participants with your words. Over to you, sir.
Thanks a lot, madam. Thanks for introducing me to the audience. At the outset, I'm really thankful to the organizers, Dr. Nitin Sharma, sir, the panel members here, and MIET for providing me this opportunity to discuss with more than 100 participants who are there. I expect that majority of them are students, and then there are a few teachers also. Okay, friends, regarding this experimental animals and the animal models that we are using for our research purpose, as well as for demonstration purposes, there are so many intricacies involved, and what happens is generally in our routine we forget to look at all those very important aspects in any experiment which are really very vastly affecting the outcome of our research, okay, or outcome of any experiment. What I'm going to share with you is my experience regarding a simple experiment of elevated plasmas. Okay, few of you might say that, okay, this is a very simple experiment, but then there are so many things that we have to look at, and that is the beauty of behavioral testing. Okay, why I've chosen this particular topic of beauty of behavioral testing is because, particularly in academic institutions, when a student comes to second year M.Pharm, generally people are relying on setting some CNS related models. We're using simple devices like, say, elevated plus maze, wire maze, radial maze. We're having some water tank in our pharmacology laboratory, or we're using simple transparent buckets to check antidepressant activity. Okay, so overall we can say that we are going for CNS related testing because we feel it is the cheaper method. Easily, without any resources, without any fundings, we can set up the models, and then we can come up with some data that can be analyzed statistically, and then we can submit our thesis as a successful M.Pharm thesis or a PhD thesis. But what happens is, we are really, in little harsh words, I will say, we're really killing science when we are setting such kind of experiments, and we are not looking at the sensitive parameters which are really, really important, and they must be looked at when we are trying to set our models. Okay, let me share my presentation. Friends, I'm going to talk with you today regarding this topic of beauty of experimental models, beauty of behavioral testing particularly. Okay? When it comes to behavioral testing, we academicians are the most insensitive people to perform the experiments. Okay, even teachers as well as students. So let me share with you all my experiences regarding this one simple device that I had in my laboratory. Before we got this video tracking system, we were very happily performing the practical of elevated plasmas. Okay, like I used to demonstrate to my students that, okay, this is how we have to perform the practical. Then I used to leave the students with that small elevated plasmas made up of blank cardboard, and then students used to observe the animals. Then they used to come up with some results and all. But when we got video tracking system, which is very, very accurate, which gives you numerical data regarding the animal's behavior, at that time I was shocked that we even could not prove the effect of diazepam on mice. Okay, anxiolytic effect of diazepam we could not set properly when we were using an accurate video tracking system. Okay, so that shattered my belief in what I was doing earlier, and that's what I'm going to share with you. So this created some sensitivity in me regarding the behavioral models that we are performing in academic institutions. So I feel that majority of you are from academia, so that will be helpful for you to look at experimental models related to behavioral testing more sensitively. That is the purpose of today's discussion. Okay, so friends, when we say behavioral testing, we have to look at the principles of 3 R's. All of us know that these 3R principles are related to human treatment of animals. But then, as far as behavioral testing is concerned, you cannot develop any alternative model for behavioral testing. This is the main problem related to behavioral testing. Okay, because for diabetes, you can have culture of beta cells. For cancer, you can have different kind of cell cultures. Even for other kind of diseases, you can have some cell culture related model or some isolated organ kind of model. But in case of behavior, it is never possible. Even today, or even next 2 decades, animals will not be replaced from the behavioral testing. That is the biggest issue. So we have to think about refinement as the major R related to behavioral testing. For replacement reduction, we can go for other disease conditions. But when it comes to behavior, only refinement is at our hands. And this refinement requires very deep knowledge regarding what we are looking at when we are seeing the behavior of animals. Okay? So this is the reason why we have to look at behavioral testing very seriously. Another issue in case of behavioral models is we are correlating a rat's behavior or a mouse behavior with human disease. Okay, you can understand the complexity of human behavior. Even when I am talking with you, there is a possibility that I am having some anxiety. Okay? My question is, can you create this kind of anxiety related to presentation in a rat or a mouse? It's not possible. Okay, so if we start thinking like this, what we are really modeling in experimental animals, then the things become more and more interesting. Okay? See, what we are doing is we are trying to regenerate very complex human behavior, human thought related disease in experimental animals. And that is the reason why translation of animal behavior into a data which can be relevant to clinical aspects in human beings is a very tricky business. Okay? With this background, let me take the example of a simple disease. Okay, simple disease because all of us feel that anxiety can be easily studied. We can easily model this particular disease. We can understand the pathology related to this particular disease and all. Okay, but when we start thinking about even the simplest disease, anxiety, there are so many complications in this. Because see, anxiety is nothing but some kind of fear, right? Now, if the question comes, can we say that fear is a disease? No, fear is something that has kept us alive. Okay, it is a very important evolutionary quality that we have developed that helps us to survive in this world. So fear cannot be considered as a disease. Then what is anxiety then? People have tried to define this particular word. Okay, why I have taken anxiety as an example? I want to tell you how much complex is the modeling of behavioral parameters. Okay? So if you really want to see what is meant by disease anxiety, then American Psychiatric Association has defined this anxiety as something that is marked, persistent, excessive, and unreasonable fear. Okay? It is not simple fear that each one of us is having. It is a pathological fear that can develop in human beings, and such pathological fear should remain in that person for quite a long time. Then we'll be calling it as an anxiety disorder. And again, it should be sufficiently affecting the person's normal behavior or normal physical activities, normal intellectual activities. All these things are happening. Say there's consistent fear that is affecting the person's intellectual as well as physical activities, and it is remaining for a quite long time. Then we can call that particular disease as an anxiety disease. Otherwise, all of us are having fear of something, and that is quite natural. Right? Now, with this particular new definition that we are looking at, I know that you all have come across such kind of definitions earlier, but if you see the complexity of this anxiety, let me take you to the next slide now. Anxiety is not a single kind of symptom. Okay, dependent upon either etiology or dependent upon the presentation of symptoms. Anxiety can be classified and subclassified into multiple types of disorders again. Okay. The definition that just now we have seen was related to generalized anxiety disorder, where the fear was there without any external stimulus. But there is another class of anxiety which is panic disorder. Okay. This panic disorder happens in the people with or without agoraphobia. Okay. Now this agoraphobia has come in many short movies and all new movies. So students at least might be knowing this. Agoraphobia is fear of closed places. Okay. So many people suffer from this kind of condition, and they become panic if they are constrained in a small area, okay, like a lift. So that kind of disease is again a subclass of anxiety. There are specific type of phobias. Okay, phobias. If you just search for phobia in Wikipedia or Google, you'll get around 50, 60, 70 different types of phobias. Mention a word and there will be a phobia associated with it. Okay, fear, phobia of insects, phobia of reptiles, phobia of aquatic animals, phobia of water, phobia of silence. All kind of phobias are there, and they can be a part of anxiety. Okay, there is very nice disease called as obsessive compulsive disorder. Okay, where a person is continuously showing repetitive behavior for very simple things, like the person will lock his room, but before leaving that place, he will be continuously looking at the lock. He will pull the lock repeatedly and see whether the lock has really been properly put or not. So this kind of anxiety also can happen, okay, which is called as obsessive compulsive disorder. There are healthy people, but unfortunately they are exposed to some traumatic situation, and then their behavior changes. So there are some conditions which can be called as post-traumatic stress disorders. Okay, all of them once were classified under the heading of anxiety. Okay. You can now understand the complexity of this simple condition. It is not just fear, it is having so many aspects in itself, and all of this can be classified into a heading of anxiety. Now question comes, can we really have an animal model for each of these diseases? Can we create a model of obsessive compulsive disorder? Can we create a model of phobia, animal model of phobia? So this kind of questions, if we start asking ourselves, then we will understand how intricate it is to set a behavioral test model. Okay. Friends, whenever we are saying animal model, what we are doing in this, we are actually considering a disease condition. We are trying to find out what is etiology of that disease, why that disease is occurring, what are the causes leading to that particular condition. We look at what are the symptoms which are occurring in human beings, and then we see what are the treatments which have been successful till date. Okay. Dependent upon these three aspects, we are trying to devise our animal model, or we are looking at our animal model. So whenever we are saying a successful or a good, valid experimental model for any disease, we are saying that that particular model enough mimics the etiology of human disease, the symptoms of human disease, and the treatment that has been successful for that particular human condition. So if all these criteria are met, then we can say that that experimental model is really a good model. Okay. Now again, the same question I would like to ask you, can we have a real animal model for anxiety? Can we mimic the etiology? Can we mimic the symptoms? Can we mimic the treatment? And then we can say that, okay, this is the model which is a validated model for anxiety. See, we started with the simple term anxiety. We felt that it is a very simple disease which we can easily model in experimental animals. But if we really see the definitions, if we really see the meaning of an experimental model, we will be convinced that it becomes much, much difficult to model even simple fear in experimental animals. Okay. Again, this complexity increases when we consider human behavior, a human disease, human anxiety. Okay. Just now I mentioned that it will be really impossible to create any suicidal thoughts in a mouse. Okay, no mouse or rat will commit suicide even if you torture it like anything, or even if it is exposed to the worst conditions. But in human beings, anxiety can lead to this. Depression can lead to suicidal tendency. Again, can we say then that symptoms of human anxiety are getting reproduced in animal models? It's not possible. There are anticipatory anxiety. Just now we thought about phobias. Okay, does agoraphobia need a medical treatment? Yes, it will need, because it is causing sufficient problem with person's normal activities. Okay. Now, again, if suppose I want to test a medication to be used for agoraphobia, can I have an animal model for that? Can I use simple elevated plasmids for that? Again, this is an important question worth asking. Okay. There is, whenever a person is anxious or depressed, there is a feeling of worthlessness. Okay. This is very, very important for human beings. Can it really happen in animals? Will a rat or a mouse feel that it is living a worthless life in any way? No. But we are having experimental models for testing anxiolytics. Okay, we are having experimental models to test antidepressants, and that's why we have to really check whether we are keenly observing the experimental animals, their symptoms, their behavior in the simple test that we are using. Instead of just thinking that using cardboard we can make a elevated plus mass, we have to really check whether what we are looking at is really making some sense or not. Are we really using a valid animal model or not? Okay. Friends, whenever we are saying an animal model or an animal test, the meaning of these two words is slightly different. Okay. When we say an animal model of a disease, we are saying that the phenotypic behavior of that animal is relevant to the clinical symptoms of anxiety, clinical aspects of anxiety, clinical pathogenesis of anxiety. Okay. If that is relevant, then we will be saying that the model is really an animal model of anxiety, the disease which are taken as an example. But if suppose you are saying that particular model is an animal test for anxiety, then you are meaning something else by this term. When you are saying animal test, you are saying that you are generating some fear in the animal and you are checking after drug administration whether that fear goes or not. Okay. Here you are not talking about pathogenesis of anxiety in human beings. You are just talking about the fear, quantifiable fear that you can induce in the experimental animal. You administer your drug and see whether that quantifiable behavior really changes after your drug administration or not. Okay. So if suppose you are considering low dose diazepam as a anxiolytic agent, then in elevated plasmas, your low dose diazepam should increase entry of that mouse in open arm. Okay, so that fear of open arm is getting reduced. This is what we are going to look at when we are saying we are testing anxiolytic agents. So we are not actually using animal model of anxiety. Okay, we are using animal test for anxiety. No doubt this is like playing with the words, but if we look at the things that we are doing in laboratory really, then it makes sense. Okay. So friends, when we are testing anything for effect on behavior of experimental animals, we have to have all these things in our mind, whether we are really performing animal model or whether we are really performing animal test, whether the things which we are observing are quantifiable or not, whether we can use particular statistical test for checking whether we are getting significant differences in treated and non-treated groups or not. Okay. Now, this particular discussion about model and test tells us that there is sufficient difference between fear and anxiety. Okay. because fear is a very peripheral kind of symptom that we can see, which is having many aspects, many pathological processes happening at the core. So upstream to the fear, there are many pathological processes which are leading to fear sensation. Right? And in our models of anxiety, we are checking the fear in animals. Now this can sufficiently differentiate that what we are checking is not telling anything about anxiety disorder. Okay, it is just telling us about the fear sensation that is being created by the experimental animal, and whether our drug is subsiding that fear sensation to some extent or not. Right? Fortunately, what has happened is whatever drugs which reduce the fear in experimental animals have also been found to be successful in reducing anxiety in human beings. Okay? That is the reason why we are saying that, okay, these models are valid. Otherwise, we are not really checking anxiety disorder in the animals. We are just checking fear sensation. Okay? Now, just now I used the word valid. Okay? When we say valid, it is related to validity of experimental model, validation of experimental model. Rarely in pharmacology labs, we discuss about validity of any experimental model. Okay? Particularly when we're going to behavioral testing, we have to again look at these two words, whether the disease is a trait disease or a state disease. This is again related to anxiety as a disorder, anxiety as a state, fear as a state of this particular representation. So if you are considering fear, it is a state of animal's behavior. If you are considering anxiety, it is a trait in that animal which will be staying in it for a longer time. No doubt there are certain models available now where the animal shows continued anxiety. But that is a new development which has come up, and we rarely use such genetically modified animals in our academic research. Okay? So here also we have to remember that we are looking at the state anxiety when we are going for animal testing. So friends, when we are using the simple elevated plus maze, we have to look at literature where the real significance of this model has been repeatedly proved. Okay. See, this author of the article which I have just focused here is saying that his results of the behavioral parameters suggest that elevated plus maze and the behavior of despair are not stable. Therefore, they are possibly more related to state of fear rather than the trait that is anxiety disorder. Okay? So such kind of literature is available, and a number of such articles, research articles you will find where the validity of any experimental model has been really questioned. If you dig into the data, you'll come across such very nice inquisitive articles, inquisitive research projects where people have tried to validate those animal models. Okay, so I now feel that up till now, I have made this point clear that whatever we are doing in our laboratories, we have to look at it very, very carefully. Okay. Now, friends, when we say validation of experimental model, there are various types of validations again, or various types of validities for the things that we are doing. When we consider any animal model, there are different types of validities, and very few times we come across these words in our thesis or in our research projects. The first validity is face validity. Face validity means the symptoms which are there in the animal, they should be similar to human conditions or clinical conditions. If suppose we want to model anxiety as a disorder, then whatever is seen in an anxious patient must be seen in the animals. Then we can say that the model is having face validity. Okay? There is another type of validity called as construct validity. The meaning of construct validity is etiogenesis or underlying biology of that disease, causes of that disease should be same as that of clinical disease. In the experimental model, whatever is the cause of anxiety, that should be similar to the causes of anxiety in anxious patients. Then we will be saying that our model is also having construct validity. Then there is something called as predictive validity. Predictive validity means if suppose a drug is anxiolytic, then your model should be able to show that it is having anxiolytic activity. Then you will say that the model is having predictive validity. There is something called as etiological validity, where causes leading to the disease in clinical setup are similar to the causes leading to that particular behavior in the animals. Then we can say that the model is etiologically valid also. Okay. There is some more kind of validities where we use the words like convergent validity and divergent validity. The meaning of these terms is convergent means if suppose there are different types of drugs, different classes of drugs which are having anxiolytic activity, then your experimental model should be able to show that all these various drugs are having really anxiolytic property. What is meant by divergent validity then? In divergent validity, your experimental model should be able to differentiate two psychologically active agents. If suppose a drug is antipsychotic, then your experimental model should be able to differentiate it from anxiolytic agent. Then you say that your model is divergently valid model. Okay. So no doubt reproducibility and predictive validities are more important to us, and whatever experimental models we are using in research, they have been at some stage of their development been validated. Only thing is when the end user or student or a researcher is performing that experiment, he may not take the required care, and that is where the results become slightly problematic, slightly confusing. So friends, when we are looking at an experimental model and that is related to behavior of the animal, we have to really ask ourselves whether this model is valid for the reason for which we are using it or not. Okay. There are other things which are coming up like ecological validity, where even the authors or even the researchers are going slightly ahead and they're saying that even social condition of the animal should be similar to the social condition of a human patient. Means sensitive people are thinking up to this extent. We have to increase our sensitivity regarding this and try to understand how actually an experimental model comes into existence. Regarding elevated plasmids, again, let me take the same example. If you see the development of animal testing of behavior, then it started before 110 years or more than that. Okay? The most famous experiment in behavioral testing was conditioning of the animals. And majority of you will know that or must be knowing that the scientist, a Russian scientist called Pavlov, for the first time showed that behavior of animal can be conditioned. I hope the audience is aware regarding that particular experiment where Pavlov cannulated the salivary gland of dog. Okay? And then he put a test tube attached to that cannula so that whenever the animal was salivating, he could measure the volume of that saliva. Okay? Then he set an experiment where he was putting the food in front of that dog and then he was ringing a bell. See how beautifully he has designed it. He has cannulated salivary gland. He can measure the amount of saliva delivered from the salivary glands. Then he is putting the stimulus, food stimulus in front of the animal. But before putting that food, he is ringing a bell. He is giving an auditory signal to the animal. Okay. He continued this particular schedule for a few days. Later on, he just rang the bell, but he did not put any food in front of the animal. What he found was, even in the absence of food, just after hearing that bell, the dog was salivating to the same extent. Means the dog was conditioned to this auditory signal and salivating, okay? Which was a very nice proof that even animal behavior can be modeled, okay? Or animal conditioning can be modeled. This experiment was published somewhere in 1903. After that, people started to look at animal behavior more keenly. So there was someone called Skinner who developed a lever pressing behavior related model in the animals, where he could teach the animals, he could train the animals to press a lever to get a food pellet, to press a lever to escape from food shock. Okay. Then there was Zeller-Shifter model, where conflict of the conflict in the mind could be created in the animals, where scientists tried to model conflict, behavioral conflict. Conflict means what? The animal wants to explore something, but that area is having food shock. So this exploratory behavior, which is natural, that is getting inhibited. Okay. So this particular aspect of behavior, people said that this can be used as a model for behavioral disorders, where animal is getting inhibited. It is getting either depressed or anxious, or it is becoming fearful, or it is getting conditioned, or it is getting wrongly conditioned. All these things could be now modeled in the experimental animals. Okay. Then came Irwin's test, which is even now used in safety pharmacology. See, it started somewhere in 1903 when no psychoactive drugs were available in the market. Slowly, the development of psychoactive drugs also happened, and these experimental models were also more and more authenticated, they were more and more validated. So friends, the simple device that we are talking about, elevated pulse maze, that was discovered and published in year 1984. Okay, so you can imagine, from discovery of conditioned behavior in the dogs to discovery of elevated pulse maze, scientists took 81 long years. And across these 8 decades, there was sufficient discussion, sufficient experimentation, sufficient opposition to the hypothesis, sufficient supportive data. All those things happened. And then after 80 years, scientists could say that, okay, this simple elevated pulse maze we can use for proving fear in the animals, and we can use it as a valid model for anxiety. Okay. You can imagine how much research must have happened in case of force swim test, marble burying test, staircase test, okay, and how much effort scientists must have put in the validation of all these tests. And even today, there are many questions which remain to be answered regarding validity of all these experimental models. When people are coming with genetically modified models, now people are again finding out that, okay, these models need to be modified. Okay, or when someone is proposing that there is a need to modify this maze because some part of the maze is not giving us proper data, again the models are getting modified. So something that was discovered in 1984 got modified in year 2015. Until then, people were using the same model. Okay. Now this is how, if you look at the experimental models in behavioral testing, then you will come to know that it is really a very complex, very confusing field, and we need to have very in-depth discussions regarding this. Okay, in academic institutions, this is more needed so that our students get sensitized to all these aspects. Now, in elevated pulse maze, just now I told you that elevated pulse maze is not related to anxiety. It is related to unconditioned, spontaneous behavioral conflict. Okay, it is a model of unconditioned, spontaneous behavioral conflict. Okay, if you see the meaning of all these terms, then it tells that you can test a mouse on elevated pulse maze only once in a month. Okay, because you are looking at unconditioned behavior. It is a spontaneous behavior again. You are not inducing or you are not injecting, administering any drug agent to cause this particular fear in the animal. It is a spontaneous fear that is happening in that particular animal. And this is a model of behavioral conflict. Many times we do not consider this particular aspect. We just say that elevated pulse maze, model of anxiety. But from where this anxiety is coming really? The anxiety is coming or happening in the animal's mind because of conflict between two things. Conflict between its exploratory behavior and the noxious or obnoxious situation in which the animal has been put. Okay. Let's look at the elevated plasmis to really understand what we are doing to the animal here. See, this is a presentation of mouse-related elevated plasmis, where you are having two closed compartments, two open compartments, which have been elevated to almost 50 centimeters from the ground level. Now we are saying that this height of the elevated plasmis is creating fear sensation in the animals. Right? Okay, let's accept that this height is creating fear sensation. And the closed compartment which is there, this closed compartment is giving some sense of security to the animal. Now, mouse is having a natural tendency to explore its surroundings. This is its natural behavior. But as you have kept it on a height, it is being afraid of going into the open part of this elevated plasmis. Now, this is creating a conflict in the animal's behavior, and it is showing peculiar behavior to stay in the closed compartments. The animal will not go into open compartment, it will remain in closed compartment for a longer time. And then we are saying that its stay in the closed compartment is the representation of its fear. And this we are relating to the anxiety disorder in human beings. You can understand how far we have stretched the outcome of this experimental model to the disease condition. Okay. But fortunately, with this simple device, you can really see that animals show a tendency to remain in the closed compartment if you observe them for 10 minutes. Okay. Now, what you are doing here is you are creating fear of height. You are providing secured area for the mouse, allowing it to move on this particular elevated plasmis and observing its behavior. Okay. Now, conventionally, when we look at this experimental model, the question comes, what is important in this device which has been created? Is it the height that is important, or the height of closed arm that is important? Let me ask you, we Indians are sufficiently lucky that we have rodents in our homes. Majority of us might have seen a rat moving at the height in our rooms. Okay? Somewhere in the roof or somewhere in the air conditioner, at the top of air conditioner, we can see a mouse, or at the top of the table or top of a cupboard, we can see a mouse. Now question comes, is mouse or rat really afraid of height? How we are saying that at 50 centimeters, the rat is having that fear in its mind? Worth asking, right? Regarding this also, there is sufficient discussion has taken place that has been published also. Okay? So whether really fear of height is involved in this simple model or it is something else. What else? There is a behavior in these rodents, mice and rat, called as thigmotaxy. Okay. Thigmotaxy means generally these rats and mice, they move in the corner of the room, or they move near to the walls of the room. Okay. There's this behavior of moving along the raised wall is called as thigmotaxy. Okay. Maybe the animal is having that particular behavior to protect itself from the attackers. But then this thigmotaxy is naturally seen in all rodents. Now, is thigmotaxy causing stay in the closed compartment? Again, a big question. Is there any role of visual clues? See, just now, earlier speaker, Dr. Nagarajan told, he had made a very nice slide where he had shown the animal, this mice sitting with a black goggle and a stick in their hands, through which he told that the mice or rats, they are having weaker visual abilities, weaker visual acuity. Now question comes, if by raising the surface of this or raising the height of this elevated plasmis, can you really create fear in the animals? Then there is another hypothesis to explain why the animals are behaving like this on the elevated plasmis is vibrissae. So if you look at any cartoon of a rat or mouse, then big mustaches are there. Okay, so these big mustaches and similar sensitive hair on the animal's body are called as vibrissae. They are providing tactile sensation to the animal. Whether presence of this vibrissae and need of being in touch with the rat surface is a important aspect in elevated plasmis. Even this is worth asking. So if we look at the animal behavior more closely and we ask ourselves a question, if at home we are seeing a rat moving on a very heighted place, and in laboratory we are saying that it is afraid of 50 centimeter height, is it really correct? So let's ask ourselves such kind of questions before observing the animals on elevated plasma. Okay, conventionally, when we use this simple example that I am taking of elevated plasmas to check anxiolytic activity of drugs, what people observed, they observed total arm entries. How many times the animal is entering into open arm, how many times it is going to closed arm, how much time it is spending in each of these arms, how much time it is spending in the central arm. Okay, so there was a time when people thought that central portion of the maze, where both these open and closed arms are meeting, that portion is of greater importance to check anxiolytic activity. Okay, it's convincing that this is the place where there is more conflict, where to go into closed arm or go to open arm is a conflict. So earlier there was a hypothesis that stay in the central compartment is more important as a parameter for testing anxiolytic activity. Okay? So these are the things which people are observing. It is funny to understand or funny to know that now the central compartment has been removed from the elevated maze. Okay? Because people said that no, it is not necessary, it is not representing anything. Right? So you can understand something that was prepared, it was considered to be very, very important in 1984 has been totally refuted now. People are coming up with something new which is not having this central compartment. Okay? It is having just closed and open compartment without any central compartment. But there was a time when people thought about this, they reported this. Even today we are having elevated plasmas with a central compartment in it, open arm, closed arm, and a square in between that connects these two. Okay. This kind of intricacy is again there. Right. So these are the conventional parameters. Okay. This is what is simply academic. Now question comes, is it sufficient to check the anxiolytic activity of a drug if we are using elevated plasmas? Having only this numerical parameters sufficient, or we need something else for that? Majority of the articles coming out of academic institutions just mention these conventional parameters. But if you see research labs which are specialized in this kind of research, then you will come to know that they are using so many other parameters which are called as ethological parameters. Ethological means behavioral parameters. So on this elevated plasmas, people are not only finding the time for which animal is staying in that compartment, they're also studying how the animal is behaving on the this particular model. Okay. Now, new research articles are saying that we should have percent protected stretch attend as a behavior. This is a very important and very sensitive parameter to tell whether the rat is really fearful or not. Protected stretch means what? The animal will be staying in the closed compartment of elevated plasmas, and it will be just protruding its body towards the open compartment or the central compartment. This is called as percent protected stretch attend. Okay? stay in the closed compartment in a safe zone, and try to just take out more than half part into the central compartment. That is called as protected stretch. Then there is something called as unprotected stretch attempt. How will you count this unprotected stretch attempt? When the animal is coming in central compartment and then it is trying to move towards the open arm. It is stretching its body slightly towards the open arm. That is called as unprotected stretch. Okay. Then head dips. If you observe the animal moving on the elevated plus means the animal will be dipping its head as soon as it comes out of central compartment. So how many times it is dipping its head is also a symptom of lack of fear. So even that needs to be counted. Percent protected head dips means here the animal is staying in the closed compartment, just taking out its head and trying to look downwards. That is percentage protected head dips. Even this behavior needs to be counted. Return to the closed arm. This animal comes outside and goes inside. How many times it does this? Grooming. Grooming means animal starts cleaning its face and its fur. That behavior we call as grooming. This is again a sign that animal is feeling comfortable in that particular situation and it is not fearful now. Sniffing. Fecal boli. How many times the animal is defecating? This is a sign of fearfulness, anxiety in the animals. How many times it is urinating? Even these things need to be observed when you are putting an animal on the elevated plus. Now you can understand the complexity of this experiment. You are not just having a wooden raised plus with closed and open arm, but you are really providing very, very close attention to how the animal behaves and you are recording all these things. So if you really see dedicated research articles, you can have all these parameters now, along with the conventional time spent, conventional entries. You can have all these multiple parameters to which you have to look very carefully. Right? Now I feel that you are convinced that even simply checking the animal's behavior on elevated plus mesh is a very serious, very complicated business. You will need much more attention to the animal when you are testing the effect of drug. And then it has been shown that all these parameters are affected by various drugs, and these parameters need to be more closely observed than the entries and stay in the compartments. Now this particular keenness of observation went to such an extent that everyone started to come up with some behavioral trait or some behavioral observation and try to correlate with the animal's anxiety. Okay. So there was a flood of articles, research articles telling that even observation of this is important, observation of this particular behavior is important, and people tried to prove their stand. Okay. And someone came up and said that no, we need not to go for so many complicated parameters, keep them limited, and whatever is conventionally being done along with few behavioral observations is sufficient to this elevated plus mesh. We cannot go beyond that. We should not make it more complicated. We should not make still more observations relevant to some effect of the drug. Okay, so now someone came up and said that okay, this set of observations, okay, this set of observations and the conventional observations, these observations are sufficient, and only we can get this much data from this simple experimental model, not beyond that. Okay, so we are at this stage where the set of observations has been now finalized. Now question comes, is it all about elevated plus mesh? No, there are still more complications, because if you see Indian pharmacology labs, academic labs particularly, so many variables are getting introduced in your reading process. And unfortunately, rat and mice, their fear is much sensitive to all these variables. Let's have a look at some of these variables, like species and strain variable. If suppose in your animal house you are having bulb C mice, you are having C57BL6, you are having Swiss albino or DBA1G, then all these mice strains show differential sensitivity, different behavior, or different, you can say, susceptibility to fear on the elevated plasmids. Now you can understand, if you really want to use an animal strain for elevated plus experiment, there is necessity that we should have proper validation of our lab setup for that particular strain of animal. Then only our results will be valid. Then only our model will be valid, and we will be getting usable or extrapolatable results from this particular observation. Okay. As an example, one of the researchers have proved that biopsy mice are least anxious on elevated plasmids. Okay. You can see how entertaining it is now. So people have tested behavior of different animal strains, and from that they have said that, okay, particular strain may not be a good strain to be used for testing anxiolytic activity. Okay. Now, how you are caging the animals, whether you are putting individual rats and mice for a longer time, even that affects the animal's behavior on elevated plasmids. All these kind of research articles have been published. Another aspect is age of animal. Okay. Generally, we do not maintain record of age of animal. We just take body weight as a parameter in academia. Okay. So, dependent upon age also, there is sufficient variation in the animal's behavior. Not only behavior, but animals' response to benzodiazepines on elevated plasmids. Okay. So, if the animal is aged, it will be showing different response to benzodiazepine on elevated plasmids. If it is young, it will be showing a different response to elevated the benzodiazepine on elevated plasmids. Now you can understand the way in which we are performing this experiment. Many times doesn't give us results. One of the reasons can be this: we are not using similar aged animals, or the gap between the age of two animals is too much. That is the reason why we are not reaching up to statistical significance of the results. Even that can be a possibility. Okay. Hormonal changes. These are very frequently happening in female mice. Within 4 days, there is entire estrous cycle. So you can imagine the kind of hormonal changes which are happening in the rat and mice, which are being used for elevated plasmids testing. Those hormones are having profound impact on the animal's behavior. You have to look at this aspect also. Okay. Handling. Now, many research articles are coming up that if you handle the experimental animal properly, its behavior on the elevated plasmids will change. If you are carefully handling, if you are touching some parts of its body just for propping it, just for making it get relaxed, then the animal shows less fear even on elevated plasmids. Okay. But if suppose the animal has been separated from its mother when it is still a fetus, then it can show a different behavior. So just imagine our animal house conditions, the way in which we are handling the animals, the way in which we are treating the animals. Can we really expect that we will be getting meaningful data out of this simple experiment? Worth thinking about. It is important that we get sensitized about all these things. Another aspect is light source. Okay. Rarely we count what is the intensity of light in our pharmacology laboratories. But if you really want to perform this elevated plasmids behavioral testing properly, you have to keep the light intensity in a specific level to get proper results out of your experiment. If the light intensity is more, it is possible that you will be losing some of the data points. If light intensity is less, it is again possible that there will be a deviation from the results which are expected. Diurnal changes. Just now, your Nagarajan sir mentioned that these rats and mice are nocturnal animals. Means they are active more at the night time. Okay. When we are testing their behavior, we are testing it in daytime. Again, a question comes: will it be really valid? The animal which is nocturnal in nature, you are testing its behavior in daytime when it is obviously sleepy. So even regarding this, we must get sensitive and we must check at what time of the day we are checking the behavior of that animal. This is a very, very important aspect. When we are checking any anxiolytic drug on elevated plasmas, you have to take care that it is not priorly exposed to the elevated plasmas. If suppose there are 40 students, 60 students performing the experiment, then it is possible that the same set of animals will be used all the 3 days of the experimentation in the college. If you are doing this, then obviously the only first batch which is using them fresh will be getting proper results. On second day and third day, those batches will not be getting proper results because the animals have learned to stay in the closed compartments of elevated plasmas. So this learning also is involved in this. Okay. Means if you really want to check anxiolytic activity of your drug, you have to use fresh animals which have not been exposed to elevated plasmas for at least 1 month. Okay. Even research has happened for this particular aspect. So while looking at elevated plasmas, we have to look into this particular aspect also. This is what I was telling just now. When elevated plasmas was devised first, it was proved to be scientifically valid. People said that the central compartment is more important. Now people have come up with zero maze, which is not having the central compartment. And the designer or proponent of this zero maze is saying that his results are more accurate than conventional elevated plasmas. Now someone has come up with just a raised platform which is having open and closed compartments. So even that is important as far as this recent development in this particular aspect is concerned. What I'm telling you, they have just used a plank which has been raised from the ground level, and in the center of that it is having closed compartment. Okay, there are no two arms. There is only single arm, and at the center there is closed compartment. And then this particular designer is saying that as compared to even this zero maze, his device is giving a better results. So few people are working on this just single, we can say single arm kind of elevated plasmas. Okay. No, not plus, it is single arm elevated maze. That's all. Okay. So we have to again think whether these kind of developments are really telling us something about animals' behavior that we are planning or not. Okay. We have to be really sensitive about the utility, or you can say the extent to which this model is representing something. If you are using elevated plasmas alone to prove something, you will be having erroneous results. Your conclusions or your inferences will not be that much valid, because it's possible that some drugs are just causing muscle relaxation, because of which animal is moving to lesser extent. There are some drugs which may be causing behavioral excitation. So you have to check whether this kind of other changes, other mechanisms are really considered while you are making out some inference from your research or not. Okay? So purpose of this slide is to again tell you that using just elevated plasmas will be of no use. Okay? It will be meaningless. You have to supplement your data with other observations like open field arena, then ectophotometer or rotarod. All these things you'll have to do. Then whatever collective observations you are getting, that will be telling you about the exact effect of drug on behavior or anxiety of the animal. Okay? So all these aspects need to be considered when you are designing a simple behavioral model. Now there are many developments which have come up in this particular field, like people are using photocells, video tracking systems have come, and you can have very accurate reading of even freezing behavior. Freezing behavior means for just few seconds or for 1 or 2 seconds only the animal is showing freezing behavior. While walking it gets frozen for some time. It is small jerk in the animal's body. This kind of observations were not possible conventionally. Now with video tracking system this has come. So if suppose for 0.8 seconds the animal freezes its body, even that is a very sensitive parameter for anxiety. So with advancement in technology, sensitivity of the observations, we are getting few more aspects added to our earlier observations. So freezing behavior is also very tricky, very important model, very important parameter that we can think about while designing our simple experiment of elevated plasmas. Okay. So this simple device has been used in literature, or has been reported in literature for testing anxiolytic activity, for testing memory, for phenotyping genetically modified animals. Okay, you can imagine the kind of utility that simple device, wooden device is having. You can phenotype whether the particular genetic change has occurred in that animal just by observing the effect of that animal on, or that particular genetic change on the animal. Then you can use this elevated plasmids to model fear associated pain and all. So there are very means we can say divergent uses of this particular model in behavioral pharmacology. You can now understand, by using this simple device in behavioral pharmacology, you are deriving so many inferences. This highlights how much sensitive we should be while designing a behavioral experiment, or while making out any inference from the behavioral experiment. Okay. So this whole data tells us that elevated plasmids is very popular model. Similarly, marble bearing is also a very popular model. Force swimming test is also a very popular model. Radial maze is a popular model. Swimming means what we say, memory related tests. Morris water maze, that too is a very famous model. But if you really want to use them, all these economic, rapid, simple, sensitive models, you must raise your own sensitivity to the observations that you are taking. Okay. And then you have to try to make the real inferences. No doubt, the observations that you are doing or you are reporting, they must be very keen, very sincerely reported things. But we must try to overinterpret what we are observing in the animals. Okay. In case of other kind of diseases like diabetes or hypertension, there we are having actual recording of blood sugar level. Here we are looking at the behavior of the animal. That is the reason why we should not overinterpret. We should not overstretch what we are observing on the elevated plasmids or other measures. We must try to provide more biochemical proofs, more behavioral, more diverse devices we should use before finalizing what we want to say from that observation. So over interpretation must be avoided. Unwarranted extrapolations also should be avoided in these beautiful experiments. Okay. What happens generally is people do 1 or 2 experiments and they start telling that no, this particular drug is better than some marketed drug and all, or it is having some 5-HT related activity or GABA related activity. They start talking directly by just looking at the animal's behavior. Such kind of unwarranted extrapolations must be avoided when you are talking about any behavioral test. I have taken just example of this alerted plasmids, which is very simple test. But whatever behavioral testing we are doing, we must avoid such kind of unwarranted extrapolations to the pharmacological activity of those drugs. Okay? Drugs being tested on these simple models. So friends, with this, I'm coming to this famous quote by Albert Einstein, where he has said that we should try to make the things as simple as possible. When we are checking anxiolytic behavior in the animals by using alerted plasmids, we have tried to simplify so many things. But then we should avoid making it more simpler than it is simple. Okay? We should not overemphasize what we are observing only on this particular device. We should, as pharmacologists, have understanding that apart from the things that we are observing, there is necessity of biochemical proofs, there is necessity of cross-questioning what we have observed, there is necessity of proving through other supportive models that whatever inference you have taken out of the study is really valid and really having scientific significance. Okay, friends, this is what I wanted to tell you, and this is what I wanted to. This is how I wanted to say that behavioral testing is really a beautiful thing that we people are doing. But if we remain sensitive to all these aspects, our experimentation will be really fruitful. Okay. All right. Thanks a lot. Thanks a lot, Preeti Madam, for patient listening. If there are any questions, it will be entertaining to discuss about this particular aspect. Please.
So I would request to all the participants, if you want to ask any question, then you may ask.
I hope this whole step was somewhat entertaining to the audience also. There are so many aspects. So if there are questions, you can raise them.
Okay, sir. I think there is.
Yes, Patil sir, I'm having my personal question,
Yeah,
because
please, please. Yeah, please.
even your presentation was very fruitful and informative. But apart from this, I want to ask, because you are having the expertise of kind of the software modeling.
Okay.
So means how feasible this software modeling is in the laboratory of any pharmacological experiment to reduce the number of the experiment, because means sometimes there are some regulation that we have to reduce the animal experiment, and this reduction I think could only be possible if we are using the software based skill development. So means how you are comfortable, or what kind of things you want to convey the faculty members, or how they can reduce their animal experiment by using this software. So can you give some idea or analyzing on this particular topic?
Okay, see, particularly I am my experimental pharmacologist. Okay, I am not a software person, or I am not a proponent of animal ethics and something like that. Okay. What I have done is, when I started to face problems in my lab while teaching to the students, then I started thinking that there should be something that students can refer to understand pharmacology of that particular experiment. I did not create software to replace any animal. My stand was, we should understand the experiments better by using simulation, and then we should go for actual experimentation. There is one of the projects on which I am working at present, which is development of a rat mannequin, a rat robotic device where students can literally perform surgery. They can cannulate the carotid artery, inject simulated solutions, and see how that particular simulated drug affects the blood pressure of animal. Okay. In absence of such simulation, if you have seen the experiment of this invasive blood pressure recording, many rats are being sacrificed just to understand how to cannulate the this aorta. Okay, sorry, carotid artery. While cannulating carotid artery, many rats die. This is the normal observation in pharmacology, PG pharmacology labs. In such cases, to reduce the experimental animal use, you can have a mannequin associated with software. But that is not the replacement for the experimental animals. Okay. Finally, you have to study the drugs in experimental animals. You have to have proper skill in experimental animal handling. Unfortunately, at degree level, the exposure has been totally blocked by the softwares which have been made available. And no pharmacologist came ahead to even claim that at least let the students do some non-invasive experiments. That did not happen in India. So my stand is not to use software for replacing animals. That is not possible also. As pharmacologist, I feel use of experimental animals is going to be there for a few more decades. If you are a pharmacology student, if you are going to relate your career to preclinical pharmacology, you have to learn all these skills, and there should be sufficient exposure to experimental animals, all these surgical skills, handling skills, when you are learning these aspects. Softwares cannot replace or even reduce the use of animals. They can just better train you. They can provide you a chance to understand the subject better. That will be removing some negative experiences that happen in wet lab experimentation. So that is the role of softwares actually. I hope, sir, this answer is convincing to you.
Right, sir. So, are these softwares are available freely, or means we have to pay some charges for this service?
Actually, earlier when the softwares were developed, they were provided free of cost because they were developed in Visual Basic software, which was easy to develop at that time. Now the development costs themselves have gone so high because the software basis change every 5th or 6th year. Okay. Earlier, what was there in Visual Basic could be done by anyone. Then came this Adobe Flash. There, software people needed some skill. Now the extent of skill required is too high for HTML version of the software. Okay, so for one experiment, if you want to develop an HTML version, you have to spend at least 2 to 3 lakh rupees. Right. So someone who is spending 2 to 3 lakh rupees for one experiment cannot think of making it available free of cost. Right. So some cost is involved in this. They are paid softwares. But if you really want to avoid using paid softwares, you can develop your own videos in your lab and use them for teaching to your students. For examination purpose, you will need some support again.
So thank you, sir, for the answer.
Yeah.
I guess there is one.
Sir, there is another question from Mihir Jindal's side. He is asking to you, sir, can we relate phobia, hydrophobia, completely in dogs and humans in case of rabies psychologically?
Okay. See, this is also a very interesting question. In dogs, because of infection and because of some alterations in brain, the dogs are becoming phobic to water. Okay, or the patient who is exposed to the saliva of such dogs, in their brain also there are some inflammatory changes because of which person shows a specific type of behavior. But then this is very, very complicated to create rabies-induced hydrophobia in experimental animals. You cannot go for such specific kind of model. And in rabies also, we are not treating hydrophobia. We are treating brain inflammation. We are treating the infection that has happened. So hydrophobia is just a symptom. We are not treating that symptom in the disease. So developing a model for rabies-induced hydrophobia will not be having a significance in terms of therapeutics. Okay. But you can have a rabies model. If rabies successfully grows in rats, you can check whether really this behavior is seen in animals also. But this will be just out of a scientific curiosity rather than any therapeutic use.
Okay, sir. Thank you so much, sir, for such an in-depth and detailed information about the beauty of behavioral test. You explained all the things very well, sir. Your session was very informative to all the participants. Once again, thank you very much, sir. We are blessed to have you with us today. Thank you very much, sir.
Thanks a lot, ma'am. Thank you, everyone. Thank you.
So all the participants, it was the third day of AKTU sponsored FDP. Let's quickly summarize the today's lecture we had. The highlights of today's session are Dr. P. Nagarajan sir lecture was on the topic animal model to study diabetic, cardiovascular and cancer research. Sir explained the different strains of mouse and routes of drug administration in his lecture. We also learned how we can collect the blood properly from the animals. Sir also explained the spontaneous and induced types of animal models. Then sir talked about diabetes and also explained type 1 and type 2 diabetes model very well. Sir also explained the screening models for cardiovascular and cancer research. Dr. Chandragora R. Patil sir covered the following topics in depth during his session: anxiety, animal models to test anxiety, psychiatric disorders, trait anxiety versus state anxiety, validation of animal models, elevated plus maze models, and variables in the EPM test. At last, all the participants are informed that Dr. Bikas Mehndi sir will also address us today at 4 p.m. today. So I would request to all the participants kindly join the session again at the same time. At last, I would like to thank to all the participants to be with us today during the whole session. Thank you very much to all.
Thank you, Patrick sir, for joining us.
Yeah, thanks a lot, sir. Thanks for providing this opportunity.